But for those of you that are just joining in, again, I am the admissions advisor, Jessica Suniga, and we have Mrs. Sapp here today and our guest speaker, Dr. Anderson. And I'll go ahead and pass it on to you, Dr. Anderson. You can go ahead and get it started.
Awesome. Thank you so much. And thank you guys for having me do this talk. I really appreciate being included. You guys put a lot of great learning opportunities for students so that they can succeed at the University of Houston College of Pharmacy. So they're great. Miss Sapp and Miss Zuniga are fantastic additions to the UHCOP family. So to get started, so I'm Dr. Anderson. I'm one of the academic fellows. I actually graduated from the University of Houston in 2022. And as you guys have probably heard when you hear about pharmacy, is there's actually a lot of different areas or opportunities for you guys to go into after you graduate. So a good chunk might go directly into retail if you want to work at a place like CVS or HEB, but there's also a big chunk of our graduates who are interested in doing residency and fellowship. And the main goal of this webinar today is to really give you guys a better idea of what the pathways to residency and fellowship might look like, what the timeline is for applications, and how to make yourself a great candidate, and also what it really looks like on a day-to-day basis. I've interviewed a resident and a current fellow and asked them the same 4 questions of what a day in the life looks like and some advice for people considering those pathways. So in addition to that, we'll have some time at the end for a Q&A. The main objectives I just kind of went over, so just describing those fellowship and residency opportunities, the timelines, also the benefits of residency and fellowship, and then we'll go through those interviews with a current resident and a fellow and the Q&A at the very end. Just to get a baseline from you guys, I kind of want to know where your mind is at currently. I want to know, what are you interested in pursuing after pharmacy school? So are you interested in maybe just going into retail, maybe fellowship or residency, maybe another area of pharmacy? Maybe you're interested in industry or nuclear pharmacy, some other area, or are you not sure yet? A lot of people are usually in that last box, but I'm curious where you guys are right now.
Right away, immediately someone is residency, exclamation point. So residency.
Okay. You're in the right spot then.
Well, it looks like everyone's picking B, so that's good.
Awesome. Awesome. I see an E. Your D. Okay. Wonderful. Well, great. So it's great if you know exactly what area you want to go into. We'll talk about residency and fellowship during this webinar. But if you're not sure yet, it's still great that you are exactly in this webinar, because you'll find out a little bit more about these different pathways and maybe if they're the right decision for you. So just a little bit about my personal path. So like I mentioned, I graduated in 2022 from the University of Houston. The bottom left picture is me as a P1. We do our white coat picture down in the common area at U of H. And then the bottom right picture is graduation in 2022. And during my time as a pharmacy student, I realized that I personally wanted to expand my opportunities after graduation to something other than retail. I was really interested in more of the clinical side of pharmacy. And so I pursued a PGY1 at St. Joseph Regional Health Hospital in Bryan, Texas. And during that residency, I also found my passion for teaching and precepting. And so that really combined into the reason why I chose to apply for this academic fellowship here at the University of Houston, because it really combined the 2 things I love about pharmacy: the clinical part and the teaching and precepting part. So This is just my personal path. Everyone's path will look different depending on what your interests are and what you want to achieve. So if you are interested in this pathway, or just to hear about maybe my residency or how I got to the position I am at today, I would love to talk more about it. And we'll have some more time at the end for questions as well. So when you think of residency and fellowship programs, most people tend to categorize them into two different areas. So when you do your pharmacy education, if you want to pursue more of a clinical focus, usually those students will be tailored more towards residency programs, versus if you have more of a research interest or focus, you may go into more of the fellowship programs. I say that, but there's also a lot of different opportunities. It just depends on the residency and fellowship program, because usually there's a combination of both clinical and research focus. It really just depends on the residency or fellowship program. And we'll talk a little bit more about that. So first, let's dive into what exactly a pharmacy residency is. Basically, after you graduate from pharmacy school and you take your boards, you're a registered pharmacist, you're able to verify different medications. A residency program allows you to perform as that licensed practitioner, but to still train under the supervision of an experienced preceptor. So typically, you get to go on rotations. You have supervision from your preceptor from different rotations, but you also have supervision from maybe your RPD, your resident program director, or your RPC, your residency program coordinator. So you still have some supervision. And typically people will pursue a pharmacy residency after graduation if they want to pursue a career in clinical pharmacy. And the training after you graduate can be divided into a PGY1, so a postgraduate year one. Usually this is much more general training, general hospital training in different areas of the hospital. So you might have an emergency medicine rotation, you might work in the critical care unit, you might work in pharmacy admin. Really depends on the program. And then your postgraduate year two, if you decide to pursue it, is more of a specialty area. So if you decide you want to specialize in pediatrics or oncology or maybe transplant pharmacy, you might do a PGY2 after your PGY1 to specialize in that particular area. Typically, your resident responsibilities, there's a lot of direct patient care. So you're using that clinical knowledge that you learned in pharmacy school almost every day, working up patients and rounding with the different doctors. There's a lot of co-precepting, so you might have students with you. You also deal with practice management, so you might help with coming up you might help with different policies, like pharmacy related policies. You might sit in on the P&T meeting, which deals with the formulary or the different medications that are included at the hospital. You also have research opportunities. You usually have a major project, which you present the findings at mid-year and usually a different conference in the spring as well. And you also have longitudinal projects depending on the type of program it is. The typical timeline, so if you realize that you want to do a residency, you do things during your pharmacy education that makes you a great candidate, but there's a lot of prep the fall of your P4 year when it comes to the actual application process. So your fourth year, you're on your rotations, they're called your APPEs, so your advanced practice pharmacy experience. And you're rotating through different hospitals, you're getting different letters of recommendation from your preceptors, you write different letters of intent for each program that you're interested in, you update your CV or your resume. And you get all these things together, and during residency showcase at ASHP mid-year, this is basically a big conference, a big pharmacy conference, where you can go to different booths that have different residency programs. You can talk to them. You can have these mini interviews, which are called PPS, to get to know the program a little bit better. And you can decide whether or not this is a program that you would be interested in applying to. So December is this showcase, and then in the end of December and early January, you actually submit your PharmCAS application to these residency programs. You either get an interview or not, and they're usually set for around February time. And you rank those programs in March, and the match happens in mid-March. That's when you find out what residency program you picked, and they also picked you at the same time, and you get matched. And after match day, you complete your Pharm.D program in May, and you pass your boards and start residency usually in June or July. Things you can do after residency. So it opens doors into other areas of pharmacy. You can go into that PGY2 if you decide that you want to specialize. If you don't want to do that, you can go directly into a clinical pharmacist job in a hospital. You can go into a fellowship. That's what I did personally, because my fellowship program in academia required a PGY1. And then there's also some opportunities for non-hospital settings, like if you wanted to go into ambulatory care, which is more outpatient clinics. And then pharmacy administration is another area you could go into that works in more of the administrative side of pharmacy. So there's a lot of different benefits of residency, and you can definitely see the competitive advantage in the job market if you are PGY1 or PGY2 trained. So it is possible to get a hospital job after graduating from pharmacy school, but it is very difficult. There's a lot of graduates from pharmacy school every year, so being a PGY1 trained applicant makes you a little bit more competitive than someone who does not have that training. So networking opportunities are also great. So I love all of the pharmacists that I was able to work with during my residency. You make relationships with your co-residents that will be lifelong, as well as with your RPD and RPC. They really want to see the best for you and want to see you succeed. So you meet a lot of people during your time in residency, as well as during your conferences. So networking opportunities are another great benefit. You also get exposure to other practice areas through training and guidance from different preceptors. So you have different perspectives that are teaching you. You have different learnings, you have different teaching styles, and different rotations that you get to experience in the hospital. And so it basically enhances all those different learning you're learning of all the different areas of pharmacy. So you get admin, you get formulary, you get policy, you get research, you get clinical practice. So those are all incorporated into residency. And overall, it increases your job satisfaction because you have that experience in different areas that you can really decide what area is the best for you when you're looking for a job after residency. So I know that's a lot of information, and sometimes I think it helps when you hear from someone who is currently going through the process. And so it's great that I actually know Dr. Levy from my own personal class. He graduated with me in 2022. He's a current PGY2 resident. So he is doing a combined PGY1 and PGY2 with Harris Health. And this is with a focus on pharmacy administration. So I asked him and a different fellow when we go to the fellow section, the same 4 questions. So we'll hear from him what his experience has been like. So just go ahead and
Hi,
listen.
Jason. Can you
to
introduce
this
yourself?
portion.
Hi, my name is Jason Levy. I'm the PGY2 HSPAL or Administrative Resident at Harris Health System, which is also a part of the Houston program.
Awesome. What is a day in the life like?
Oof, that is a very good question, especially for the administrative residents. It really depends on our rotation. For the most part, for me, usually I start by checking my emails like any other good admin resident does, seeing what meetings I have on my schedule, and if it's a more meeting-heavy day, I'll try and prepare for any meetings I might be presenting at, or if I'm just more listening in, trying to get an idea of what that meeting is going to be about so I can ask pertinent questions and see how I can contribute to that group. If I'm more on a hands-on rotation, where I need to do audits, I make sure to prepare by looking at what item I'll be auditing and ensure that I go through my audit checklist to know what questions I need to ask and prepare myself by going to the actual site and seeing all the different items that I'll be inspecting to ensure that I hit every item and ask the pertinent questions as necessary.
Cool. Very cool. What would you like to do after this?
After this, I'm still trying to decide that. I think for now, my major project focuses on implementing a hospital at home, which is this idea of taking an admitted patient that you normally treat in like a med-surg unit, but actually treating them at home, still inpatient. So I could potentially go into that field and be more of like a manager in that regard for a hospital at home. Or I might actually look into medication safety, as that's been a really huge interest of mine, as well as opioid stewardship.
Awesome. Why did you choose residency?
That's another good one. I was actually a late bloomer in that sense. I wasn't always thinking I was going to be in administrative pharmacy. I think it was like towards the end of my third API, beginning of my fourth API, I really honed in on either administrative pharmacy through the Houston program or through industry, being like a medical science liaison. Both completely different paths. But for me, I still wanted to stay close to the patients that I wanted to care for, which is why I initially came to pharmacy. But I still wanted to ensure that I got the clinical experience, because I felt if I went industry, I would pigeonhole myself into that one field of pharmacy. It'd be hard for me to leave that. This way, I feel if I went into admin, I can still see all of the admin-related duties, but at one point in time, maybe transverse into the industry field. I also felt with administration, since my past experiences had been through a lot of organizations, helping my colleagues remove any barriers they might have to delivering the best care to their patients was something I would be able to garner experience in through this administrative residency.
That's a great thought. Great idea. The last question I have for you is, what advice do you have for those that might be considering residency?
Reach out. I highly recommend looking inward. Is residency really what you want to do? Because it is a year-long commitment, sometimes 2 years. And if you know that direct patient care in regards to rounding with the team, being able to make recommendations, and truly impacting your patients in that way is something you want to do, residency is definitely one of the best ways to get there, being that specialist in the field. But also being able to reach out to those currently doing the residency, getting an idea of what their day-to-day is. Because, you're getting my insight from me, and I barely cover the surface of even what I do on a daily basis, because the rotation does depend. The health system does differ. So kind of taking all those ideas into consideration and making the decision based on all these different experiences and reflecting on your own is really the best way to determine if this career path is the right one for you, or at least residency. And then again, residency at which site, because that also matters just as much as doing the residency itself. So reaching out would be my biggest piece of advice.
Wonderful. Thank you so much for your time.
Of course.
Bye.
So I hope that was useful to see what someone's day in the life looks like as a resident. And if you have any further questions for Dr. Levy, I can give you his personal contact information as well after this. But moving on, we'll go into what is a pharmacy fellowship. So fellowship is a 1 to 2 year postgraduate training program in a focused area of pharmacy. So typically you might see fellowships that are focused in industry or maybe academia. It can be research focused, or you can also work for a governmental organization. And these training programs, you might be able to go into directly after pharmacy school, or you have to complete a PGY1 and then go into a fellowship. So it just depends on the type of fellowship. Some of the common fellow responsibilities, this really depends again on that area of focus. So if you go into a pharmaceutical industry fellowship, you may be focused more on drug development and pharmacokinetics, maybe clinical trials and medical affairs, versus an academic fellowship like what I currently experience. There is that clinical and translational research, but a ton of teaching and facilitation. So I get to lecture, I get to facilitate in skills labs, I get to precept students when they come to our Vecino clinic, which is an ambulatory care clinic. I also have service opportunities within the Homes Clinic and working with different student organizations. So not only do I get teaching and facilitation, but I also get the opportunity to go on clinical rotations. So I have a rotation with Houston Methodist as well as Vecino Clinic for 2 months of clinical service. And then lastly, research fellowships. They have a lot of protected research time. So there's a current infectious disease research fellow that is working in the resident office, and he has a lot of protected research time. He works with one of our faculty members on a couple different research projects, but he also has a clinical practice site at Baylor St. Luke's, so he goes in rounds on patients. So he still has some of that clinical knowledge being used. And lastly, he does also incorporate some teaching and precepting as well. The timeline is similar to residency. However, the application process is a little bit earlier in the year. So you determine what fellowship you want and if there is a residency requirement, and then you would apply to that fellowship usually in October through January, like in that time period. And that's usually either before your pharmacy graduation if it doesn't require a residency, or it's before your residency graduation if it does require a residency. Interviews are usually in February, and then you either accept or reject the position, and you pass the board exams, and if you haven't graduated from pharmacy school yet, and start in the fall. Typical, oh, the lights just turned off in the room, just 1 second.
Yeah, so a lot of the lights in the building are, motion censored. So I guess you just need to do a little dance, Dr. Anderson.
Yes, I did. Okay, so after you are fellowship trained, you can go into a bunch of different areas. So if you maybe did an industry fellowship, you can go right into industry. You can do clinical practice in combination with teaching, which is what I hope to do. I hope to get a faculty position that also incorporates some clinical practice. You can work for the FDA or the CDC. Those are those governmental agencies, or NIH. That's a big researching body that if you wanted to do further research. And then you could also work with drug development. The main benefits of fellowship is you really become trained to be an independent researcher. And depending on that focus area, you have those specialized skills for that chosen field. So if you wanted to be an academician after your fellowship in academia, you should be trained to have those skills, as well as like if you wanted to pursue pharmaceutical industry, a industry fellowship would help prepare you for that. So it's really giving that specific training for whatever area of pharmacy that you are interested in. So just like last time, I think it's great to hear from someone currently going through the process and see what it might look like. So this is actually my co-fellow, Dr. Dunn, who is currently working at the University of Houston College of Pharmacy with me. And she has agreed to be interviewed as well. So we'll listen to what Dr. Dunn has
Hey,
to
Koren,
say.
can you go ahead and introduce yourself real quick?
Yeah, my name's Koren. I am one of the academic fellows, and I went to Texas A&M's College of Pharmacy. I graduated 2022, and then I went and did residency. It was a general hospital pharmacy residency at Baylor Scott and White Medical Center in Temple, Texas. And then I am now in Houston, which is actually where I was born and raised, so I'm happy to be back in the city. And I'm currently training to become a professor at University of Houston College of Pharmacy.
Awesome. So what's a day in the life like as an academic fellow, and what are you working on right now?
Yes, good question. So I would say a day in the life of being an academic fellow is very similar to what you would expect for someone who's working in academia. So one of the professors, typically a clinical professor, since a lot of the rotations we will also have a clinical focus. So you really wear a lot of different hats. Like for instance, my schedule, I facilitate a skills lab every Monday and Wednesday afternoon. I have a lot of different meetings, especially depending on which rotation I'm on. Currently, I'm on my administrative rotation, so that's more of a leadership focus, and so I'm meeting a lot with people who run things at the college, essentially. There's a lot of meetings about finances, about the strategic plan of the college, and about working on committee charges and things like that. Besides that, every other Friday I precept a interprofessional education activity, and I basically help train pharmacy students on how to perform medication reconciliations on patients and give them guidance on that, but also show them kind of just how do pharmacists work with other healthcare professionals, specifically medical assistants, residents, doctors, and how are they able to prepare themselves to make drug therapy recommendations in the best way possible.
Awesome. Thank you so much for that answer. What would you like to do after this job?
So after this job, I want to be clinical assistant professor. I think it will vary depending on who you talk to and whoever does an academic fellowship. Some people really just want to do teaching and they don't necessarily want to have a service or a patient care site, but I really do like the clinical side. So I would hope for having a practice site that is involved in internal medicine, which is a hospital-based form of pharmacy. It's more generalized medicine, so you're usually taking care of a lot of patients who have things like infections in the hospital, diabetes complications, liver impairment patients or renal impairment patients. So it's like a more broad area of pharmacy. And then I would also combine that practice site with teaching, with doing research with students and my colleagues, and also some other service opportunities like being a part of committees at the college, helping with precepting of community service events and health fairs and things like that.
Awesome, very cool. Why did you choose an academic fellowship?
I think I chose this because if I wanted to continue my training and specifically be better at teaching and precepting, there's not that much opportunity available in residency programs because they're highly focused on training you to become a clinical pharmacist, but you don't get as much training in how do you become the best preceptor you can. I had experiences as a resident where I took students, but it's difficult to train students when you're learning yourself and you don't really have the proper guidance to become better at teaching, better at setting goals for students, better at having them take charge of their own learning and helping them grow as a future pharmacist. So I think that was partly why I chose the fellowship, as well as just learning how to teach more and give more lectures and things like that. I wanted to strengthen my presentation skills, and I specifically wanted to be a mentor to students rather than just working in a hospital.
Wonderful, thank you. The last question I have for you is, do you have any advice for people considering fellowship for their career path?
Yeah, so I guess my advice would be that you really want to do your research. You want to know exactly what you're looking for in your career, because you start planning for your potential residency year or fellowship year well in advance of when it happens. So usually you start doing your application in December of the year before you start, and then you start interviewing in February, you figure out where you're going in March, and then finally come July or August, you're now starting. And things can change in that time frame. You can get exposure to other, rotations you really like, and you may question whether you really want to do that. So I think it's really important to just be completely prepared, do all your research in terms of what you're hoping to get out of the program, whether you see yourself doing that career, and just being open to all the opportunities of growth, because no matter what program you're involved in, there will be things you're not good at and things that you think you're good at, but then maybe you could always grow, and you'll always be learning. You're a lifelong learner as a pharmacist, so I think when you decide to choose a program, you really have to step out of your comfort zone and just be open-minded to learning a bunch of new things and embrace the experiences that you get.
It's a great answer. Thank you so much for your time.
Yeah, no problem.
Bye.
So she's great. I really hope that that kind of shines a light on what her experience is and what an academic fellowship might look like. Just to bring everything together, I wanted to focus on the differences between residency and fellowship. So you can divide it by these different attributes. So the impact on patient care, you would say for fellowship might be more on a global scale, whether it's through your research or maybe your teaching, maybe some clinical practice as well. Residency, you have individual cases that you're rounding on every day, because that use of clinical knowledge is used daily when you have your direct patient care. Versus in fellowship, it really varies depending on that functional area. The general structure for fellowship is usually that 1 or 2 years experience in that core function, plus or minus different rotations. And then for residency, you have that 1 year or PGY1 of general practice. And then if you choose to, you can specialize a year after that with a PGY2, a postgraduate year 2 in a certain specialty of pharmacy. Practice setting is more corporate for fellowship, so you might work at a university that is a college of pharmacy. You might work in a drug company, or within a drug company if you go into like industry. Lots of different areas for fellowship. Residency might have more of is usually more inpatient and outpatient, like in a hospital or in a clinic setting. And then scholarly activities, both of them have teaching, research, and publications incorporated into the program. It just may vary on the proportion. And then lastly, the salary is a competitive stipend. So it's not that full pharmacist pay, but it pays the bills while you are getting your additional training in the area that you want to focus on. So with all that information about residency and fellowship, you might be asking yourself, well, how do I make myself a good candidate? And I think the first thing you can do is start off with researching your options. And you guys are currently doing that right now by being in this very webinar. So really research your options, listen to different people in those areas of pharmacy, see how they got there, and incorporate that information with your own interests and your strengths. So what will you be passionate about? What are your strengths? Where will you succeed? And once you have those answers, really get involved in that specific area. So if you realize, man, I really want to do industry, get involved in the student organizations that are involved with industry. So like get involved with IPHO, maybe get a leadership position. If you're interested in clinical pharmacy, maybe get involved with SDCP. Maybe you want to get involved in some research. So keep these in mind as you are a student. Also finding a mentor. So going back to talking to different people, find someone who has the dream job that you want, see how they got there, and ask for advice and pick their brain on what a day looks like for them to see if that's something that you would like to pursue. And in that process, you really network with a bunch of different people in the field of pharmacy. Talk to the people in the class above you, in the class below you. Talk to your faculty members, talk to your preceptors, really get to know other people in pharmacy. And lastly, be yourself on interview day. So you go through all of this preparation to have a good interview and to have everything ready for your application, but not only is the residency program choosing you, but you are also choosing the residency program. So listen to your gut, apply to places that you truly want to work at, and just try to be yourself on interview day. The great thing is about the University of Houston is that there's a ton of different resources for students to be successful if they do choose to pursue residency or fellowship. So like I mentioned, there's a lot of student organizations that not only can you be a member of, but there's also different events that they put on. So for example, PLS has mock interviews that you can participate in that will help prep you for job interviews or residency interviews. SCCP has a research mentorship program and a poster presentation workshop. So you can use these opportunities to help prep you for different requirements of residency or fellowship. There's also co-curricular sessions. So we have a wonderful Dr. Wallace who puts on a lot of different co-curricular activities. And these are really workshops and sessions to help with student professional development. We also have a lot of opportunities with our rotations when you are a P4 student. So when you are a fourth year student, you have the opportunity to apply for these LAPI or LSEP programs. These are basically longitudinal programs where you have multiple rotations at one hospital. So it can be 3 to 5 rotations that are at one place. So you get this longitudinal period of time at one hospital or organization. And it's really for people who are interested in residency or like a hospital focus. And it's something that you can apply for. It is not required. And I personally did not do a LAPI or an LSEP program. So it's not required, but it can be beneficial for people who are interested in pursuing residency or hospital pharmacy. And then lastly, during your P4 year, our experiential program and our student services program has put together some great on-campus days for you as a student. So after every rotation, you have a day here at the college, and we have different things available to you. So we have a resume and a LinkedIn workshop. There's interview practice. There's a job fair. There's financial planning. There's mid-year navigation and preparation, so helping you prep for that big conference with pharmacists and different residency programs. And so a lot of different opportunities for you as a student to prep you for these different pathways. And it really shows when you look at our match rate at the University of Houston. So just last year, of the students that applied to residency programs, 80.9% of those students matched with a residency program. So that's a really great statistic about our college. And also, we had the highest number of students matching and the highest number of applications among Texas institutions. But going forward, there are a lot of different resources for students to really hone in on what programs might be right for them. And if you're interested in residencies like the ones that I saw in the chat, you might start with the ASHP Residency Directory. So this is a site that you can go to. If you just search ASHP Residency Directory, you can go to this site and click on the Residency Directory. And here it allows you to search for different programs depending on maybe you want to find a residency program in Texas or in Houston, or maybe you're open to out-of-state residencies and you just want to look at what specialty programs they have, or if they have a PGY2 in a specific area you want to specialize in. So this is a way to kind of start a list going of potential residency programs that you might want to apply for. If you click on a residency program too, it gives you a lot of basic information about them, and it will also tell you if it is accredited. Being accredited is really important because it means it reaches ASHP standards for a residency program. So if it's not an accredited program, it might raise your red flag of why is this program not meeting those requirements? And if you're not an accredited residency program, graduates from the program cannot sit for their board certification specialty test, and they can't pursue a ASHP accredited PGY2 program. So that accreditation is important. Another resource is through ACCP, and you can look up different residency, fellowship, and graduate programs just through their website as well. And then for more specific residency and fellowship opportunities in managed care, like if you're interested in working maybe in like Humana or Kelsey-Seybold, AMCP is a great resource for looking up those programs. And then lastly, if you are interested in industry, this is another specific fellowship opportunity. You can go on their website and they have a catalog that tells you about a little bit about each of these different fellowship opportunities. So with that in mind, I would love to answer any questions that you guys might have. Thank you guys for your attention today. And I hope this answers a lot of your questions about what residency and fellowship might look like and how to be a great applicant.
Thank you, Dr. Anderson. That was great. And then like she mentioned, please take a couple of moments to complete the survey. I'm also going to drop the link in the chat box. It's just really important to get this feedback for Dr. Anderson and then to see maybe what other information you would like to hear about. So go ahead and complete that survey. But also if you have any questions, go ahead and drop them in the Q&A chat box and we'll have Dr. Anderson answer those questions for you. And then also, I think it'll be really fun and a little bit after we give them time to complete the survey, maybe we could do the your first question that you had at the beginning where you're asking about like what they're interested in and see if like maybe for those of you that joined a little later, like are you interested now in maybe a residency or fellowship? Or if you were initially interested in a residency, maybe now you're like, oh, I could do a fellowship. So I think it'll be fun after you complete that survey. So just take a couple of moments for that.
Yeah, I'm always interested in like hearing what other areas of pharmacy people are interested in pursuing. There's so many different options. I remember when I first started, I was like overwhelmed with all the different things that I could do.
Yeah, and then I think it was nice that you brought in, Dr. Levy and Dr. Dunn, because you get to hear like not only your perspective, but also other people's perspective and like what their experience is like. Because even Dr. Levy, he's doing like his residency now, but he's still like, oh, like he's not sure like what specific pathway. So it's like you don't always have to like know right off the bat like what you're going to be pursuing. So I know a lot of our students right now are either going to be entering for fall 2024 or maybe even future terms, but you still have time to make those decisions. But again, just take a couple of moments if you haven't done so to complete the survey. I think it'll be great to have that feedback.
And I was going to say, it's funny, Dr. Anderson, add to your long list, like to your CV now. You are now a farmer because you have just planted the seed for many other areas of pharmacy that our students can now enjoy and explore and learn more about. So you're Farmer Anderson as well. Dr. Farmer Anderson. That was great. That was great information. I'm sure a lot of people learned a lot today.
Thank you so much.
Oh, I see a question.
Oh, wonderful.
Oh, is that a question? Okay. Comments.
Yeah.
Nice. Good comments.
Yeah, Julia, he's a wonderful resource if you want to talk about the Houston program. He was actually on rotation here last month, which was kind of cool because I got to talk with him a little bit. That was actually when I interviewed him, and I think he really enjoys it. So if you are interested in that Houston program, continue that conversation. I'm sure he would love to, bridge you to other people too and continue that conversation.
And then I'm also going to drop one more link in the chat. So if you, now that you know about like residency and then our match rate as well, if you're interested in our Pharm.D program, so you can complete that before starting a residency and fellowship. And if you have any questions, go ahead and schedule an advising appointment. So that's the last link that I added in the chat box. It can be in person or online. And we can talk about any requirements or any questions that you might have about our program or even residencies and fellowships.
Oh, you're
Oh,
doing the Lappy at Harris Health. That's so cool.
Yes, congratulations, Julia. That's amazing. Good for you.
I don't even think I had the I think they added so many of those Lappies. There's like 13 Lappy programs now. I
That's
think we were-
incredible.
yeah, that's wild. That's awesome. Let's see. Thank you, Stephanie. Let's see. I'm applying to pharmacy school without a bachelor's degree. I completed the requisites needed. Does that disqualify me from some fields? No. If you complete those prerequisites to get into pharmacy school, you are, on the same playing field as soon as you start pharmacy school. And you save some time.
yeah, because for a lot of these like residencies and fellowships, you just need to have your Pharm.D, right, Dr. Anderson? So then even if you don't have a bachelor's, it's fine as long as you complete your Pharm.D, then you would be eligible for these programs. But that's a great question. So we have a couple of more minutes, so go ahead and ask your questions in the chat box. I'm also going to drop my email address in the chat if you have any questions. And then also you have Dr. Anderson's email address in the screen. So if you have any questions for her, feel free to follow up. I'll also be emailing this recording if you want to have this just for future reference. I know it's kind of early on for a lot of you, but you can always refer back to this information because it was really great to hear about the different programs and the different resources. So keep an eye out for that email. And let's see, any other questions? Great, so it looks like we don't have any questions, so I'll give y'all 10 minutes back to your day. So thank you, Dr. Anderson, that was really helpful. And then thank you everyone for joining us today. I hope you all have a good rest of your day. Thank you.
Hey.
Thank you, everyone.